From Tidal Health Group, this is Health Impressions, where we break down healthcare marketing strategies for consumer brands with industry experts. I'm your host, Bryan Cush.
I'm really excited to talk. As much as I've only recently got to know you, I feel like we're going to jump right into some pretty thick and heavy conversation. So I'm really glad we got to do this.
Thank you for having me. I'm excited to be here. And yes, in the few times that we've been able to talk, heavy topics, but are so important right now to the healthcare system.
Yeah, I'd love just for people that don't know you, if it's really your background or how you think about just how do you package all the expertise and experience that you bring? How do you describe that to people?
Oh boy, that's a tough one. Um, I feel like I have a passion for the oncology space simply because I'm a survivor, and now my sister is as well. And so a lot of personal experience within that realm. And then I was most recently with Mayo Clinic as the director of marketing for the Comprehensive Cancer Center. Prior to that, I was with Rocky Mountain Cancer Center, so a lot of years in this space. But I've also had the experience of living outside of the US, working with small nonprofits. I've been in, like at Activision, doing video game marketing, and so it's all over the board. But I find it so rewarding that I've had experience outside of healthcare so that I can understand what other
Mm.
industries are doing and how that consumerism really should be one of the main focuses within healthcare. And so I think that I have that perspective. And it's super frustrating when I see healthcare systems saying, like, you have to have healthcare experience. I think we need to see a blend in order to start making progress.
Yeah, I could derail us on the you have to have a healthcare comment real quickly, but yeah, and not to minimize your personal experience and your personal healthcare battle, but that to me sounds like it just feeds into you being one of the most experienced people from every angle possible, thinking about how we should be treating someone going through cancer.
Yeah, there and when I start looking at because I'm 19 years past treatment, and so when I look at my experience compared to what my sister is going through right now, um, the care that I had, I almost feel like it was primitive, which is interesting to see because at the time, of course, I didn't, right? But there's been a lot of progress in the space, which is exciting and probably what keeps me motivated the most for what we can do today in this space and where it's going. But it is also what really concerns me because when I start looking at somebody like a Mayo or an MD Anderson or City of Hope, Cleveland Clinic, all of these really large institutions that are now talking about care in home or in mobile units, those kinds of things, right? And so with my experience also at Rocky Mountain Cancer Centers, I start worrying about these small practices that are in our communities that have small margins to begin with. And now all of a sudden, these large behemoths are going to be in our backyard as well. So, how do you start
Mm.
competing, right? And so, there's all sorts of questions in my mind, especially from a marketing perspective, like, how do you compete? How do you compete?
Mm. I think it's a perfect springboard. I mean, the background of our company was in these small, sometimes single, multi-doctor practices. We even particularly stay in that kind of mid-enterprise range as well for I think a lot of those reasons. And maybe that's the springboard to start to think about this from the marketer's perspective is when I always look at smaller enterprises and in industry, there's usually a nimblism and just a dynamism to act faster than the bigger companies. So a language you use a lot that I think is really important, and I'll just firstly say I agree with, is marketers not really then making the connection to just the business of healthcare, of going, we really need to change the dynamic of thinking about are we connecting to and causing the patient visit, the patient start. And I have to just make the like human comment that like that is just the beginning, especially of the a prolonged journey of a cancer patient, but it is still the beginning. how do you think about stepping into a system or just talking about changing the dynamic from marketing metric, conversion, click into this patient start destination?
I am grateful that early on in my career, I had a boss that what he taught me was you first need to understand how your business makes money. And that needs to be your sole focus. How do we make money? And when you think about the healthcare system, that's by patients, right? And even within cancer, one of the things that I saw at Rocky Mountain Cancer Centers was that the physicians are like, I'm busy, right? Like my template is full. I don't have space for more. And yet you're trying to drive in new patients. But when you sit down and you talk to operations and you look at the types of patients that the physicians are seeing, it's not new cancer patients. A lot of them are revisits, which of course aren't going to drive revenue growth. Some of them are survivors that are well past 5 years, also not going to drive the revenues that they need. So when you start looking at, okay, so how do I make revenue? And it sounds callous within oncology. I get it, right? But we're all businesses, and without that revenue, there is no mission. And so we have to be able to talk about how do we make money, and are we seeing that right patient mix or just new patients in general? And then not only am I converting those patients, so are they coming in? How many are now staying and how many are going into treatment? Because again, you have to understand how the business is making money. And if you as a marketer aren't doing that, in my opinion, you're not doing your job.
How do you begin to educate the marketers then? Like, I think there's such a legacy experience and muscle memory of this kind of, for lack of a better word, siloed optimization. Just like thinking about conversion, click, metric. Like, there's a lot of bridges there, data wise, system wise, people wise, language wise. Like, where do you start, or how have you approached it in your experience?
The way that I've approached it is by creating relationships internally with finance and operations. I would make sure that I was talking to operations ahead of time, ahead of doing any sort of a campaign, in order to talk about, do we have capacity? Do we have capacity at which locations, right? Or different specializations? I would make sure that they understood when the campaign was going to start. I worked with them on the expectations. So how is it, like if we're driving call volume at all, how are you guys handling that? Who's handling it? What is the process for getting a patient in? Because part of the problem too, especially within like, well, it's so prevalent now within healthcare, right? When you think about the time to wait for an appointment, it's not just bad with PCPs right now with the shortage of them, but it's also bad within cancer care. And so when we would look at the time to the first appointment and what that would do to no-shows and or cancellations, it is in one office, it could be as much as a $20 million problem. So part of that would be the relationships within those, but then also being able to quantify it so that they can better understand like what we're missing, and that it becomes a sort of a corporate wide initiative, shared scorecards, those kinds of things, right? Being able to pull the right people into the meetings, having common and frequent conversations, and holding those people accountable.
Yeah, I can't not think of just it's almost a fundamentally different description to what commonly is a marketer.
Totally agree. I totally agree. But here's the thing. I don't think it should be.
Hmm.
I don't, right? Because so I've heard recently somebody say, like a director of marketing, my job isn't patient acquisition. Like, what? What is your job then? Right? Like I
Hmm.
I don't believe in the days anymore where we're just doing advertising, right? And I'm calling it advertising on purpose, Because I think that there were days, right, where we said, I'm just going to create some ads, especially traditional media. My job is just to build the brand and build some awareness. We are still responsible for creating awareness today. We have way more channels than what were available when I first started in the industry. But um, again, how does the business make money? My job is to help the business make money. And if not, I'm not doing my job.
Do you see that? I don't know if it's obviously a kind of post marketing in one conversation, but do you see that as kind of like emblematic of the current situation that people aren't look like energy is more focused towards brand and people aren't trying to make that kind of last performance connection? Or is that kind of a systemic problem that there's just lack of data to make that decision?
I think there's a lot of lack of data, um, disparate systems within healthcare. Um, what I see a lot of is people want to put a lot of money into search, especially because of the last click attribution. Um,
Mm.
but I think that that has all sorts of problems, right? But I do feel like, though, that upper management, so CEOs or executive directors, COOs, CFOs, I think that there are more people asking more of marketing today. And I think that there is an evolution within the industry to say our jobs are to generate patient acquisition and therefore revenue for the health system.
Do you see almost like a new title forming or a new, is it just a shift of roles or is it like fundamentally new roles being created?
It's just a shift. Although it has been interesting to see some recent articles about the CMO is the chief marketing officer role is changing or there's some institutions that are getting rid of it. That's interesting to me and I don't quite know where that's going. Um, but otherwise, I just think that it's a shift in expectations of the department. But I think that there is a dearth of data available because we can't make those connections. And there's always going to be that age old problem of tell me what TV produces,
Mhm.
right? I don't, whoever is going to solve that problem will be a millionaire. But I just, right? Like, I think that there are certain things that we will have to do that we won't be able to put a good number on in terms of attribution.
How do you think about then going upstream from that conversation? So I think I'm hearing there's this first kind of under the hood conversation of like, let's just talk about capacity. Let's just talk about where we can even take patients. Are we looking at the right high value patients? Do we have the systems to convert that patient? Are we giving a poor experience by making them wait a month? It's like you solve all those things and knowing some of your background being from kind of top of funnel, for lack of a better word, on the content down to bottom, like where do you then start to translate when you get those inputs from the business?
So I look at my budget in a couple of different ways. So I'll look at it in terms of like working dollars versus non-working and make sure that I have the right mix to be able to generate patients, but I still have the content in order to do that, right? Like you need
Mm.
both. Um, but I think that there are some areas where they're focusing on non-working, and then if you don't have the promotion of it, you're not, right? Like if nobody ever sees what it is that you're creating, you're not actually doing anything with it. And then the other way that I look at the budget is what is my mix between the different channels, um, and knowing that demand is going to grow the brand, like the awareness portion of it, right? And I need the awareness of the brand, um, because, and I think that we've had this conversation before in terms of like the 95-5. So at any point in
Mhm.
time, like 95% of people probably aren't in the market for your products, 5% are. But if you're only focused on that 5%, like you're leaving a lot on the table. And so I look at how much am I putting towards creating awareness, and then how much is going into the conversion. So if I think about search as a conversion channel, it isn't about creating demand though, right? Like that demand is coming to you. So how will they know about you in advance? Um, so I'll do a mix between awareness creation as well as the conversion.
Maybe double click too, just in case if people don't fully understand, especially in the 95/5 rule. Like, it shocks me sometimes that I like even conceptually tell people like, really, people don't really think about healthcare until it's a problem. I mean, we struggle enough to get people to probably do primary annual exams. Like, people aren't actively thinking about cancer unless it becomes a problem. So, how do you think about that 95/5 rule? Maybe even it is the lens through oncology as well.
Um, I had heard somebody say once, which I think is clearly it stuck with me over all of these years, right? Like, if somebody is coming to my website, they have a problem. They have a problem that they want solved now. And you're right, it's different from like PCP, like I have the flu or I've broken an arm or something, right? Versus cancer care, where I would even argue like 95.5 is probably 98.2 instead,
Mhm.
because at any point in time, right, like somebody hopefully isn't getting diagnosed. But um, when we think about cancer care and we think about what people are doing, our horrible habits at night where people are watching TV, but they're also on some other device. I mean, it shows in all sorts of data, right? People are on 2 to 3 devices as we're just sitting there at night. So somebody is scrolling, but nobody is going to be scrolling and looking for cancer. And like they're not going to even look at cancer because cancer is too ambiguous. And so when somebody starts thinking that there's something wrong, they're going to start Googling at that point, but it's going to be specific to what they're seeing or feeling. And then once they need a test or once they have a diagnosis, they're very specific in the types of searches that they're going to do. So, like if it's about breast cancer, they're going to say like HER2, breast cancer, or triple negative, right? It's going to be very
Mhm.
specific about their diagnosis and what they need to understand. But then all of a sudden, it's super urgent, right? Like when you hear those words, you have cancer. I, it is so hard to describe the feeling that you have, and it's not just this anxiousness. It is this fear where you're like, all I want is this out of my body, and can we do that now? And so it's different if you're looking for like an orthopedic surgeon or if you're looking to, just go and get a physical. Um, Cancer care is just different. Um, the emotions that go with it and the fear, right? Like mine was early stage, and yet you sit and you think about like, how long am I going to live? Like, what am I supposed to do about this? So, um, for me, it's super important that people start thinking through the screening, getting the care they need. And so, how do I show up
Mhm.
when they are at probably the lowest in their lives?
And it makes me think just almost like full circle to the conversation we had the last 20 minutes of as the marketer, if you're not starting with internally, can we handle the conversion I'm about to make? You're just doing your own job at a service. And then pile on what you just described as just the persona and the emotion of that individual. If you're then handing them into a system that says, oh, it's days, weeks, or months till we can see you, like that's so in friction with these all these we are patient first mission statements.
Yes, absolutely, right? And the behavior that we see within this industry is that um, they will either stay within the health system in which they started, right? So through navigation, or they will call a system that they know of and trust, right? So there's some awareness there. So they will call for that appointment. They will take whatever is first available. But if that appointment is too far out, the behavior that we see is they will continue to call around to other cancer
Mm,
centers and then take the first available. So it might not even be the physician their first choice, right? But they're going to take the first available appointment. And then on the other side, what we've done is we've made it super hard to actually cancel an appointment or to call to say, like, I found this other one. So now you
mm,
have a no show. And then that causes all sorts of problems, right? Because so I used to do loyalty programs for Northwest Airlines. And so if you think about airline seats, the minute that that plane is left, if you didn't sell that seat, that revenue is lost forever. And it's the same within any sort of healthcare system, right? Like if somebody is a no show, that's revenue that you will never get back. You can't. You
mm.
can't. And so, what are we doing in order to increase conversions? What are we doing in order to increase capacity? What are we doing in order to create those relationships with patients before they ever come so that they want to keep that appointment even if it's further out? Because some of the problems of capacity we won't be able to fix, right? There's a shortage. There's a shortage of physicians. So, but what are we doing in order to create those relationships and opportunities for patients?
Yeah, I mean, it makes me have a shared colleague now. I think it probably talked about is just the mental availability concept of just easy no, easy to buy. And if you're putting so much friction in the process and waiting schedule, you're just fundamentally going to push that customer somewhere else.
Without a doubt, right? Like who wouldn't? Who wouldn't do that? Why would we
Yeah.
expect anything less just because we're an oncology center? Like really? Like that alone should say like you're not patient first.
Yeah, it's fun. I mean, we demand it everywhere else in life. You're thinking about drawing inspiration from other fields. I literally thinking about a dinner reservation I had, and they were busy, and they kept calling back to us every 5, 10 minutes, just letting us know we apologize. We put the check down. They're gonna get up. You have your seat coming, and that was just dinner. Like, so clearly that brand understood that it needed to meet the consumer's demand there, and that was just dinner. Exemplify the fear state that you just described of someone dealing with that in healthcare.
Yeah, it's, and again, if we go back to earlier in the conversation, when we start thinking about what are our jobs within marketing, and if we continue to believe that it's just about creating campaigns, I believe that we're still missing the other part of the equation, especially when we start thinking about patient first. So, what
Mm,
is our role in ensuring that that patient actually comes? And for me, that's a part of measuring that revenue and the conversion, right? Because like if I even get somebody to create an appointment, I actually need to be looking beyond that to say, did they come?
yeah.
There's no revenue if they don't show up. There's actually lost revenue.
Yeah, it's funny. You're making me think of another colleague. I think we interviewed a few, well, too, that they're working at just the kind of appointment conversion process of actually creating like physical off ramps, so they could see kind of through the digital experience when they needed to trigger a human intervention through scheduling. And it really, it to me was like that is customer first in that moment of just there's such a mentality to be so ops forward in healthcare of this like fill out 9,000 forms and like slot everything in its perfect like ICD and CPT and like diagnose your self alignment. And just that's so much friction through just the inquiry process.
Yeah. At Rocky Mountain Cancer Centers, we were looking at different ways of, before what I'd said is like creating a relationship. So in order to have a patient start, there's so much documentation, all of the scans and the diagnosis information and everything else that the oncologist needs before they really have a good first consultation with that patient. But we were looking at, could we start earlier with the information that we had in order to make the appointment shorter, but have the oncologist meet the patient, and it could even be a virtual meeting, in order to talk about here's what to expect.
Mm.
Because some of the fear going into the process as a patient is, I don't even know what is coming, right? Like, I just don't,
Mm.
you don't know what you don't know at that point in time. You don't even know the questions that you're supposed to be asking, right? Like, that's a lot of what I had Googled ahead of my appointments, where it's like,
Mm.
what am I supposed to be asking? How do I make good decisions? How do I participate in my care? And so if you could even have a short virtual appointment, and we were looking at, does it even matter if it's the oncologist versus an APP? How do you fully
Mm.
utilize the staff, right? And does that increase patient starts? Um, no surprise, it does, right? Like, they tend
Yeah,
to be
shocker.
persistent, right? Like, what? Engagement with a patient makes them want to stay?
Yeah, it's funny. It makes me think of yeah, I think it was the same colleague of this. There's such a marketer's mindset. Like, even if we can measure technically now that, say, appointment is scheduled, that there's in this like putting down of the armor as the marketer, like, oh, our job is done. Like, even if we get the systems technically to do that, that's still not the end of the mindset on how to continue that journey forward as the marketer and following the customer through the experience. So I think even that gap that we've talked about that we're trying to bridge, it sounds like you really just fundamentally shift the model to go, no, I'm already looking at the customer journey holistically, not just solving that next step.
Ideally, right? Like, that's what we're doing. What I would say, though, is a problem within the system itself, though, is once we've started a patient, there's, and we believe that they're going to continue through treatment, because that's how oncology makes the vast majority of the revenue, right? Is actually treating a patient. Um, but from a marketing perspective, at that point, we have to start thinking through, if we want to spend any more money on improving the patient experience, because there's no additional revenue at that point.
Mm.
And so I've always been in these organizations where it's like, we get them in the door, and then that's where we stop, right? And so from a patient perspective, I wish that there were more opportunities to think through what that experience looks like. But again, it doesn't drive revenue, because if they're going to stay, that's the revenue that we would get anyway. And so then any other additional money spent on that patient experience is lost, right? And so when I look at it, unfortunately, I say, okay, they're in the door, they will go through treatment. I'm putting the rest of my
Mm.
budget back into creating demand.
Yeah, I'd be curious though if you agree with this though, is that increased expense on the customer service side or the customer experience won't put revenue increase at the moment, but I think there's the argument is made that it can increase retention in the future state, which is more of that brand bucket investment that's really breaking a short-term mindset though. That's just like that's a whole nother problem than to try and take a marketer. How do we tell marketers in these systems and go, oh, now you got to demand what's probably categorized as like an operational budget into use as well. But I think it's still important to say, like, not that it doesn't, and push back if you disagree, not that it doesn't increase revenue forever. It just doesn't increase revenue to that patient's experience, but that cost should have an effect on future retention.
Yes and no. So I believe within oncology that it can help generate better word of mouth. Although within oncology, you end up with this really different dynamic between a patient and the physician because in most cases, that physician is literally saving their life. And so
Mm.
there's this affinity um, from the patient perspective that I believe is different from other, like my PCP, like I'm going to judge that person every single time I go to see them, right? And have so many opportunities to switch. Whereas within oncology, I'm not measuring lifetime value like I would in any other sort of instance. Um, because I'm hoping that this is a one and done, that you are cured, and that 5 years from now, I can push you out of my system and say, enjoy the rest of your life, right? Like,
Mm.
make the most of it that you possibly can, um, hoping that they never get diagnosed again.
Fair enough. Yeah. I mean, that's the importance of such an understanding of the consumer journey just in that service line, let alone how I think we fundamentally don't understand the consumer journey into healthcare as a total bucket, let alone now the nuanced difference and how you just articulated oncology.
Yeah. If I was within like PCP, all day long I would be focusing on that full consumer experience all day, right?
Mm.
Yep, without a doubt. It was one of the things like when I was on the Northwest Airlines account, we would be looking at what point are people making decisions that are affecting the long-term and lifetime value of that, that flyer. So, and that's what I bring into healthcare. So again, that's where
Mm.
I'm glad that I have this balanced perspective. But oncology is just a little bit different because I am hoping as a survivor, right? Like I'm hoping that we see this one patient that we are able to cure them, and then I hope that they have bonus birthdays for as long as they can.
Well, as much as I feel like I could talk to you for 9 days, maybe that Hope platform is a great, great way to let us kind of close out. And I have too many questions that I feel like there's a part two already in the works. So
Well,
I
fantastic.
appreciate all the time.
Yeah, this has been a lot of fun. And hopefully it generates some thoughts amongst our peers.
Equally. I mean, I think that's on the title side is something we really pride ourselves in is trying to help educate our clients of just kind of breaking what we've talked about here. Like, how do we break the walls down in the expectations between departments? How we look at are we truly customer first? And it starts with a conversation. So I appreciate the time and all the experience.
Thank you. It's been a lot of fun.
Thanks for listening to Health Impressions. Subscribe on your favorite podcast platform so you never miss an episode. Leave a review to help us improve and connect with us on social media. Keep exploring, learning, and pushing boundaries. Tune in again soon.